Hey guys, so I noticed a couple of people have asked or had some problems understanding the PICO portion of the research notebook. PICO is just a mnemonic to help you remember the main portions of a research question, a clinical research question. One thing that people have had a little bit of trouble with is understanding what these things actually mean. So the P in PICO stands for patient problem. Or if you had a public health question, it could also stand for population. Basically, this is just how you describe the patient and what is their primary medical problem that you're trying to treat them for in some fashion. The intervention is what you're considering for the patient's care, whether that's surgery, medication, counseling, whether you want to use a diagnostic test, change their diet, etc. The comparison, there will not always be a comparison in your research question. So comparison is really optional. Sometimes people also call this control, and that's been the source of a little bit of confusion. Comparison or control just means the alternative. The comparison is what is the other option. Sometimes in a clinical situation, you're choosing between two different drugs, two different surgeries, or maybe surgery versus no surgery. So not every question will have a comparison or control. A lot of times you're looking at an intervention versus just letting them live their life. No other medical intervention, just no care, no medical care. And if that's the case, then the comparison or the control won't appear in your research question. I'll show you an example of this shortly. But the outcome is what you're hoping to achieve. So are you trying to improve their quality of life, reduce their mortality, minimize side effects of a drug? There are a number of various medical outcomes that you might be looking for. Time is also optional, but time is a part of research questions when we have to follow up with patients to see whether the intervention was successful. For example, when we talk about cancer patients, often we're talking about increasing their 5-year survival rate. So we're taking a look at the next 5 years after the treatment is given and how well they do over that period of time. Not every research question has a period of time in it, but it is a possibility, and a lot of them do, especially when we're talking about clinical research questions where researchers are trying to determine whether an intervention works, but they can't necessarily follow the research subjects over their entire rest of their lives. They just want to do a follow-up in 1 year, 3 years, 5 years, and see how they're doing. So in this example, Sally, an 18-year-old female, has just been diagnosed with a deleterious mutation of the breast cancer susceptibility gene 1, which is called BRCA1. She has recently started taking oral contraceptives. She asks you if taking oral contraceptives will increase her risk of early onset breast cancer and whether she should change to another form of contraception. So in this sample scenario, our patient, well, there's a lot of ways we could describe her. We could say a young female. We could, say she's 18 years old. Really, what we're talking about is the BRCA1 gene mutation, and generally only females will have this. So we don't have to worry about describing her as a female. We can just say someone with a BRCA1 gene mutation. And with regard to the intervention, well, this isn't a medical intervention that you're planning to give her. This is something that she's already doing herself, but she's taking oral contraceptives. Oral contraceptives is the medical intervention that is happening in her life right now. The comparison, what she's considering instead, is taking another kind of contraceptive, presumably a non-hormonal one, right? Because she's worried about breast cancer being the risk of breast cancer being increased by the hormones she's taking. So maybe she should be using condoms. Maybe she should be using a diaphragm or another version of non-hormonal birth control. And the outcome that we're interested in is whether or not her risk of early onset breast cancer is going to be increased. So we have to figure out whether that outcome is more likely because of this medical intervention. So the patient problem is the BRCA1 gene mutation. The intervention is oral contraceptives. The comparison is a non-hormonal form of contraceptive. and the outcome we're interested in, a risk of early onset breast cancer. It would actually be good for us to have time here. So say within the next 15 years or something. Normally when you're looking at the research, you are going to find that they can't follow some people. You can't necessarily follow people for the entirety of their lives. So you might get in the research literature, you might get something that says the likelihood over 20 years is the same as a person who is not taking hormonal contraceptives. But for our PICO question, we're just going to use these four things. So the way I've written it is this. So in patients with the BRCA1 gene mutation, does oral contraception compared with non-hormonal contraception increase the risk of early onset breast cancer? And I used a template. Let me just end the slideshow so I can show you. There's actually a PICO handout template. And the template is available from your week 4, where you can go and read and watch the materials. There's PICO question templates. So if you come here and click this, you can actually see the templates for how to set up your research question. Okay. So if you find the template is kind of clunky, for example, in patients with BRCA1 gene mutation, does oral contraception compared with non-hormonal contraception increase the risk of early onset breast cancer? There's no reason you have to write it like this. You can also write it putting the control at the end, or the comparison at the end. So in patients with BRCA1 gene mutation, does oral contraception increase the risk of early onset breast cancer compared with non-hormonal contraception? Both things are saying the same thing, right? Here is another example. So I have a research question. Does pre-hospital tracheal intubation increase survival rates for patients with out-of-hospital cardiac arrest? When you look at this research question, you can see that it's built from PICO building blocks. So we have a patient problem. The patient is having out-of-hospital cardiac arrest. The intervention we're considering is tracheal intubation. There's no comparison listed here. And then the outcome is increased survival rates. So I hope that helps a little bit with what PICO means and how to use it.